lovely viewers. Did you know there is a fatal bacterial infection that can cause muscle spasms and affect your nerves so badly that it can even lead to death? Yes, there is, and this fatal bacterial infection is called tetanus. On today's episode of Abatan here at City Star TV, we are going to discuss what tetanus is, what causes it, the treatment plan, and preventive methods that we can take to make sure that we don't get infected by this bad disease. My name is Anaya, and as always, as I keep reminding you, if you haven't subscribed to our YouTube channel, please do so. Hit the notification bell. Follow us on all our social media handles on Facebook, TikTok, Instagram, and Twitter. The name is City Star TV. I'm going to give you a couple of seconds to do that while I take a short break. Welcome back. So before I took the break, I reminded you that there was indeed a bacterial infection out there that can actually cause death. It affects your nerves and it causes bad muscle spasms that can even cause you to die. And this disease is indeed called tetanus. It also happens to be one of the 6 killer diseases affecting our children in this country and other countries across the globe. Today we have with us our beautiful midwife from New Taco Government Hospital, that is Madam Benedict Hasari, once again, to educate us on what this disease is, the preventive methods we can take, the treatment plan, and how to prevent it altogether. Madam Benedicta, you're welcome once again.
Thank you.
So today we just delve right straight into the topic. So what a lot of people don't really know what tetanus is.
Yeah.
Like, we know that there's something when you go to the hospital, they tell you need to come for tetanus injection. Sometimes even when you get cut by some metal or yes, they'll tell you, oh, the way this nail cuts you, you need to go for a tetanus injection. What actually is tetanus?
Okay, so as you rightly said, tetanus is actually a bacterial infection, and the name of the bacteria is called Clostridium tetani. Please don't worry yourself.
I won't even try.
Yeah. Yes, so it's true. It causes spasm, and then it disturbs some of your nerves. It is very true. Now, tetanus is not just about a metal cutting you or something. It actually attacks you through an open wound. So when you have an open wound, no matter whatever brought the wound, if you have an open wound, it can. Yes, it can. Okay. And then the tetanus bacteria, it is found in soil, dust, and some of human stuff. So yes, it can attack you like that. So let's forget about the fact that it comes when a metal cuts you. No, when you have an open wound.
So any open wound out there can get infected.
Yes.
By tetanus. That's what
sure.
Saying here.
Yes,
okay.
That's it.
So how do I know if I have an open wound? Because sometimes we are prone to injuries. You never know. You are cooking, a knife cuts you. That's an open wound right there. You brush up against a hard surface, or even just trying to get down the staircase, and you can even bruise yourself on the stair, the edges, and all these sharp things. We are prone to injuries, and we get cut all the time, and these leave open wounds. How do I know that my open wound is infected and I have tetanus?
So when you have an open wound, first, you don't have to treat your open wound with just anything. In our parts of this country, anybody can just, you get a wound, somebody can just say, oh, I'm going to take a champon from Bigusoma. It doesn't work that way. So formerly, or in the ancient times, or when our grandparents were treating our wounds with all those kind of stuff, there was high rates of infection during those times. But yes, so when you have an open wound, you treat it well, such that as you are treating, you don't introduce bacteria into the wound. Do you understand? Yes. So in newborns, they also get it. So somebody will ask, how can a newborn get an open wound? One of the ways a newborn can get tetanus is when the mother has it and doesn't treat it. Through delivery process, the child can get it. Okay. Yes, especially when the mother didn't go to a hospital to be delivered and then was delivered maybe at home by these traditional birth attendants. Now you see some of them, they don't use sterilized materials, instruments for that.
Yeah.
They just pick anything and use to cut. They will just cover their hands with anything and enter. You understand? So now, if the bacteria is around and then the person enters, the person has introduced it to you. Do you understand? Yes. And then the worst part of it is that when a child is born and then you are treating the cord, you see, the cord is very fresh, looks like a fresh wound or something. So we advise the mothers that they clean it daily, at least twice or thrice daily with spirit and cotton. Or there's another thing that we use called the chlorhexidine. That one, if you don't know how to use it well, you might cause trouble. So if you don't clean the cord well and you just use anything to clean the cord, you might also be introducing
Bacteria.
it, yes, to the child. Because it's open. You know, the cord is open and it has something that has clamped it like this.
Yeah.
So when it opens, it leads directly into
The
the
navel of
child.
the child.
So anything can just go straight into the child.
So, like you see, she's telling you to be very cautious how you handle newborn. And most of you that try the home birth, if you are doing that, please have sterilized instruments. Better still, just go to the hospital. Just go to the hospital. Make sure that the environment in which you're doing this is very sterilized and safe before you infect this baby and the mother herself with these kind of bacteria. We are talking about a whole lot, and we have a lot more to discuss. So stay tuned, and we'll be right back. We are still here on our time here talking about this very dangerous bacterial infection called tetanus that can happen to any of us if so long as you have an open wound. And our beautiful midwife from New Tafel Government Hospital is still educating us on what this disease is and how it causes. Madam Benedicta, so let's talk about what to know. I have an open wound and I know it can get infected by tetanus, but how can I tell? What are some of the things that happens when you, to my body, or yes, the symptoms that I will let me know that I have a tetanus infection?
Okay, yes. So let's start from the children since we are concentrating on the newborns. Now, when a child has tetanus, that is when they get the spasms, the muscle spasms. So they will have this muscle twitching small, then you see that, yes, yes. And they have very difficulty in, because of the spasm, they can't really suckle the breast milk very well because, it's also, as a result of that, it causes a jaw lock.
Okay.
So you see, just one complication. It is one problem.
One infection
is causing that. So they get the facial, the muscle spasm, and then because of that, it locks their jaw, and they are not even able to open their mouth to
eat,
to take the breast milk.
Wow.
Yes, it is that bad. Aside that, there's this high level of restlessness, and then of course the fever comes. Yes. As for the fever, it's
basically
cuts across everywhere.
Yeah, a lot
yes.
of
Yes. And then there's rigidity. This child will complain, like you would see, the abdomen is very rigid and very, very tender. Then the facial muscles are also rigid. So yes.
That means the child, that will cause severe pain for the child.
And because of that rigidity and the spasms, there's also seizures.
Wow.
Yes.
It's a very fatal infection indeed, because it's giving all this to one little baby, one little child out there. So please take note. And what other, aside those things, is there anything else?
Oh yes, it affects their urinating when it gets severe. Like when it gets to that point, they have trouble in urinating, and they are always kind of restless and tired.
So
yes,
exhaustion
is it sets in.
Wow. Yeah. And since it's an open wound and we talked about the case, what about, is it similar in adults as well?
Of course, if you're an adult and you also get an open wound and you don't treat it well, you will also present these signs.
With the same signs.
Yes.
So if you're seeing these things in yourself or your child, you know that there's something wrong somewhere. I mean, you don't even need to be told, but these tell you that that fatal infection is actually with your child has it or you have it, so you need to rush. You don't have to wait till it gets too late before
Sure.
you need to rush to the hospital and get treatment for these things, because it can really get bad. Because if
Yes.
your jaw is locked, there's rigidity in your tummy, you're having problems urinating, you're
Yes.
exhausted. I mean, come on, take yourself or your child to the hospital and get immediate medical care. So now we've talked about the symptoms.
Yeah.
Let's go treatment. When these things happen, how when I've seen these, I rush to the hospital. How is it going to be handled for me?
So your first attempt of treatment is when the mother is pregnant. We start tetanus for them. So you have TT1 during pregnancy. Give them TT1, TT2, so that when after delivery, we also schedule TT appointments for them. It starts from, I think, when the child is 6 weeks. Yeah, 6 weeks, then 10 weeks, then 14 weeks.
Every 4 weeks.
Yes, for the child, so that the child doesn't get it, because it is very difficult for a newborn baby to get an open wound.
Okay.
But it is
Yes.
also very easy for the child to also get tetanus because of that umbilicus thing. Now, in this setting, you see, when we deliver and we take the child home, we get our mothers and our grandmothers who become the doctors of the house. Now, they will be telling you, oh, use this, use this. When I gave birth to you, I used this. And some of these things, they are not sterile. You see, they just picked them and they started using them. So you don't know where they've even kept them for that period. So as you are introducing, you are just giving. Same as adults. When an adult, maybe you were doing something, or maybe you had an accident or something, you had a cut, then your skin is broken. Now, when your skin is broken, it means that it is open into the body. So it is easy for something to invade that open something. So you want to treat a wound. You don't just treat a wound as in, I'm going to get, so I have a wound. You just pick any cotton anywhere, then you get your spirit to start treating it. No. Sometimes they are that bad that if you don't have any idea about treating it, just go to, if you don't want to go to the hospital, go to the pharmacy. Tell the pharmacist, this is the problem. At least because it's a pharmacy, they have everything as sterile as they are. Then they can give you, and then you can treat it.
So when you go to the hospital, they are going to first start treating the symptoms?
Yes, no, they will treat the wound first. Then, because the wound had been infected, they will also suggest further tests, and then they will do it for you. Now, there's tetanus immunization. It protects you for 12 years.
That's quite a long time.
Yes, it protects the child for 12 years. So if a child is had the vaccines, all the vaccines that he or she needed when growing up, and then the child is now 10 years, then accidentally the child gets a wound, you don't, if the mother really went for immunization and stuff, if she went religiously like she was supposed to go, then there's no need getting another tetanus injection,
Because the kid would have been inoculated.
yes. So after the 12 years, then they really give the tetanus vaccine. So after 12 years, it has already protected you. You are done. So what they can do for you is that when you get any wound or something, they can treat the wound and then give you the tetanus injection.
So she's actually spoken to us about this. She's telling us that when it's time and you're being asked to go for your tetanus shots, please do from pregnancy. Do when you deliver, you're supposed to take your kid after 6 weeks, 10 weeks, and then 14 weeks.
Yeah.
Every 4 weeks after that. Then you go for, make sure you complete your tetanus vaccination. You take all the injections that you need to take, and this way you protect your child for 12 solid years. Come on, it's that simple. Protect your child. Just sacrifice 12 weeks to religiously go for your injections and protect your child for 12 good years. We are still learning a lot, and there are a lot more that we need to learn, so we'll be right back. So the discussion is still ongoing about what tetanus is and what causes it. Apparently, there are a lot that we take for granted when it comes to this very particular bacterial infection. We have a lot of beliefs in our community that causes it, and even sometimes when these things happen, we overlook them and attribute their causes to other things. That reminds me, initially I mentioned when you get cut by metal, that's when they say go for tetanus because the metal is rusted. Especially in our community, when you step on a nail, what's the other do as well? After the yaka is you or for a friend and tetanus.
Yeah.
That's when our mothers they'll take your foot or whichever part you step, yeah, your foot and put it in hot water, boiled water and kasa, put some salt. Some even put hot stone on the fire and
Yeah.
then put like this. Does that help in any way?
It doesn't. It doesn't. Sometimes you might be doing more harm than good to the person, because it is not just a metal that can give you tetanus, an open wound. So anything, even a metal, an insect bite. You know, when you are even bitten by a dog, you should treat it as urgent. When you go for a surgical procedure and you don't take care of your wound well and you allow it to get infected, you can really easily get the tetanus. So we don't limit it to just that. If you want to treat a wound, treat it the right way. You know, in our setting, we just like the baby parts where we can say, oh, me na bi na eye me. Nipa we de ni bi ahwe me mpe. But we don't also think, like, we don't go beyond that to think that, yeah, to think that, oh, let me take this thing to the hospital and see what they will tell me. I always say that you wait. We understand that be you Ghana. We understand. But just go for the doctor to tell you that it is not curable. Then you can go and apply your spirituality. Until then, you don't have any reason to do that.
So you can even go to the hospital, and if it's curable, let the doctor try and cure it for you. If it's a curable disease, unless the cure and the treatment plan is not working, before you can even jump to conclusions, but at least wait for your treatment plan to kick in, and then before go by what your doctor is saying. Basically, don't stay home and make your own assumptions. Just go to the hospital. The hospital is open for you at all times. So let's come to, is there any way we can prevent this thing? Because it's actually very serious.
Yes.
So are there any preventive measures?
Of course. We can prevent. It is a lifestyle we have to adopt. Now, one thing I want us to learn is that we can do if we do a whole lot of good by learning and just listening to the doctor's advice, I think it will go a long way for us. Now, if you want to prevent tetanus, if you have a wound, don't be when you don't even have any idea about the condition you have. So why do you want to just treat it any way you want it? Now, sometimes you might be a diabetic and you don't even know. So the wound is not even healing. You will try everything and it will be getting worse. And you'll be introducing the bacteria and you are not aware. By the time you realize,
it's too late.
Everything is out of hand and the wound gets worse. So most of the time when you get to the hospital and you have a wound that is not healing, you have a wound, you've tried everything, they'll tell you, let's run some tests for you. That is when you can even realize that you have a condition you're not even aware of. If you want to treat your wound, let's say you fell, something happened, somebody hit you with something, an insect bit you and stuff. Treat it well. If you are using an antiseptic, you can just use water and salt to clean your wound. It doesn't mean that boil the water to make it so hot. And your wound be near the hot water, it treats it. Sometimes you don't even need the hot water. But you need to clean it. You know, the salt is good. It can clear the surface for you. So sometimes if there's any bacteria there, it can just clear it. You clear it. Don't cover it. If you like, cover it because you don't want any dust to be entering. Then take it to the hospital. Tell them, oh, I have this one, but I don't know how to go about it. So my mom is an example. Some of our mothers, you know them. Once I fell, I had a small cut. My brothers will hold me. My mother will be using hot water. and I'll be shouting. I had a certain wound at this area. I was young,
Yeah.
and surprisingly, it took me months for that thing to heal because of the way they were dressing it. Do you know the surprising part? When they stopped doing all those things, it
That's when they
healed.
started healing, yes. Because they don't even realize that they are doing more harm.
It
Every time they
healed.
are putting the hot water and everything on it, they're actually making the wound fresh.
Of
again.
course. Sometimes the rate at which your wound will heal, sometimes it depends on your immunity. And it's not even sometimes, almost all the time. If you have a strong immune system, you don't have to do much. Just keep it clean and use the right medications. You will be fine.
So these are some of the things. Basically, keep your wound areas clean. Make sure it's treated. If you don't know how to go about it, take it to the hospital. Don't wait for it to get infected. That is the most preventive way of making sure that you don't get tetanus. It's the best way to make sure you don't get tetanus because it can only infect you through an open wound. So if you know you're only treating your open wounds very carefully and in the right way, you will not get infected. Maybe you're not getting this. Maybe you're not getting how important this is that you prevent yourself from getting infected. So our big super midwife here is going to tell you some of the complications that will come as a result if you don't prevent yourself from getting tetanus and you really get it. These are some of the complications you're going to go through. Can you tell the public? Please?
Oh, yes. So when you get, so it means that your wound is going to get out of hand. Sometimes it affects your tissues. If you get it internal, it will really affect some of the tissues that you have to go through surgery for them to remove the affected tissues. And you know, surgery.
It's not that simple.
No,
it also comes with some
a hygiene. And aside that, you can also get yourself, you can be adding other conditions to your, sometimes the wound becomes so bad that if you don't take care, you have to amputate that part of your body. As for that one, I always say, but one thing I'm very particular about is for the babies. You don't handle babies anyhow. Infections, diseases can just enter a baby and it will just get worse. I always say that babies now are not more because they don't have the mouth to tell you.
When you're in pain or what is going on.
So if you want to treat something, if you want to dress your baby's wound, if you want to do anything for your baby, please do it the right way. That's it.
So she's told you all these can come. Imagine this, having a small cut on your arm and then not treating it right, so much so that it gets so badly infected. Now you're going to lose your entire arm. Which one would you prefer? Go to the hospital, have it treated and keep your arm, or stay home and have it infected and lose your arm? I guess the choice is yours. We've learned a lot today, and I think we are going to take our final words and words of advice from our beautiful midwife here. So any words of advice?
Yes, so my words of advice, please, are fashionistas, for instance. If you are going for piercing, know the kind of person you are going to, the things, the needles they are using. Probably you are not the only person they've used it on. And are they even clean and sterilized? And then since you are going to, if the moment they pierce, it is going to give you a wound. No matter how small, it is a wound. If you don't take good care of it, it is just going to get out of hand. So just do the right thing. And those who take care of, especially the TBAs, the traditional birth attendants, please, if there's something that is above you, we beg you. We know that your traditional things help. But if you don't understand, refer them to us. We'll take care of you. When you have a wound, dress it well. If you can't dress it, go to the hospital. It doesn't take much. Sometimes you can just even see a nurse and just ask the nurse, please, I have this. And I don't even know how to go about it. He or she will help you out. Open wounds, the wound, no matter how small it gets, a bacteria can just enter. And then as for that tetanus, but it will just enter and just mess the whole situation up. Because they do well in such areas, when you allow them to enter your wound, they just get too well, too comfortable, yes. And they will harm you.
Okay, thank you so much. I guess we've all learned a lot today. The choice is yours. Just follow through your vaccinations. Get yourself treated. When you have a cut, don't leave it. Then don't take it to chance. Don't leave it to chance. Don't wait till it gets so bad that you have to lose that part of your body. Just make sure that All your open wounds are treated well. If you don't know how to get it treated, go to the hospital. The doctors and the nurses are there to help you. It's been another educative episode of About Time here, and we are ending it. We thank you for your time. We thank you for coming all the way from New South Wales Government Hospital to come and educate us on this today. If you haven't subscribed yet, please, I keep telling you to do so, or you'll miss out on episodes like this, exciting, informative, and educative episodes like this. Subscribe and hit the notification bell. Follow us on all our social media handles: is Facebook, TikTok, Instagram, and Twitter. The name is City Star TV. I'm your host, Nonaya, as always, and I'll catch you same time next week.